Hello? Let's make sure we had it right. We got the title. Hello? Let's see. Let's make sure. I think we're good here. How y'all doing? Looks like we got one person in the chat here. Please put all your questions in the chat, guys. How y'all doing, guys? Please place all questions in the chat. So I went live earlier. Actually, I set this up today, but I was saying, let me move this. I don't even know if I'm using this correctly. Can y'all hear me better now? This, I'm just using the YouTube software. Let's see, participants. We don't have any participants right now, just me. Okay. Pop out chat, toggle timestamps. So yeah, guys, I went live last week. Wanted to get a feel for if this is something that people would tune into or what. And we had a few people come in, just trying it out. So this time I scheduled it at 2 p.m. to see if people would join. And so far, no one has joined. I'm of course going to talk about a few things. I'm going to talk about our programs that we offer, as well as talk about a few other things. So if you're watching this after the fact, you still get some value from this. So hope everyone is doing well. So we got 2 people here in the chat. Let's see. Please put your questions in the chat if you have them. So as I was explaining before, this is something we tried last week, and I think we got up to 4 or 5 people in the chat at the time. So we're just going to answering your questions, you guys. We are answering your guys' questions. If there's no questions that come in, I'm going to talk about a few topics, and then we'll kind of get on with the program. So hopefully you guys get some value from this, and I really like doing this. All right, so hydro hose typed in, what is this? So if you have any clinical research questions, you can go ahead and ask them. I will answer them. I don't know if you are a troll or what with a name like that, but you can definitely ask your question if you have them. So yeah, thank you guys for tuning in. So far we have one person, one other person in the live as well. Hydro Hose, do you have a question? I guess not. Okay. You see everything, it all breaks down in front of you, the essence, the air itself. Okay. This guy is just a troll. I'm not even going to pay him no more mind. Unless you got a real question, Hydro Hose, go do what you got to do. Are you interested in clinical research at all, Hydro Hose, or are you just here to troll? All right, nothing else. Okay. All right, we got Avanash coming in. How you doing, Avinash? Do you have any clinical research questions? I'm here to answer your questions right here, right now, guys. Um, I did this last week. Did this live last week, and overall good turnout. Didn't really have too many questions, so today I wanted to kind of schedule this, see if people would kind of tap in. Can you guys hear me? Okay. I just need to get a. Next time I do this, I'm getting the real software. I'm gonna have the real software. I'm just using YouTube right now. Just kind of want to get a feel if this is something people even wanted. We got 4 people in the chat. This is going well. Let's see who we got. Vanaj, Hydra Hose. Okay, got 3 people now. Any questions? Any clinical research questions? Okay. Avinash asked, "What is the scope for clinical research in India?" Avinash, what do you mean by the scope? Clinical research is heavy in India and getting even bigger and bigger. Um, India has over 1 billion people. I mean, so there's 7 billion people in the world. So 1 out of 7 people in the world live in India. Oh no, does India have 1 billion? What? No, China has 1 billion. Actually, hold on. Hey Siri, how many people does India have?
As of 2020, the population of India was 1,326,000,000.
Yeah, India's got over 1 billion people, like I thought. Hey Siri, what's the population of China? Hey Siri, what's the population of China?
In 2021, the population of People's Republic of China was 1,400,000,000.
Dang, I didn't realize that. China and India almost have the same amount of people. So China's got 1.5 billion, India's got 1.4 billion. That's a lot of people. So yeah, best believe there's a lot of clinical research going on in India. So for carrier, what's scope for clinical research in India for carrier? I don't know what that means. What do you mean for carrier? Yeah, please. Let's see. How I look. This person, Praful, asks, "How do I look for internship in CR? What is CR? What is CR? Oh, in clinical research. Um, Praful, where are you? Are you based in India? Because the answer is the same. Whatever the job platforms are, I think Indeed is over there as well. Um, you're just gonna look for jobs. However, you look for normal jobs. One of the best things you can do for looking up internships is um, go to people that you know work in the field in clinical research field already and ask these questions. You can go to local sites and ask if they need help. You can kind of get your start interning by volunteering. Volunteer if they need any help with anything. It could start with just organizing a closet or coming in and taking temperatures of the IP, different stuff like that. Um, okay. This Hydra host says, "I'm not convinced that they have enough data to start people on lifetime treatments that alter them, and why do they give everyone the same stuff?" Hydra host, I don't know. Are you even in clinical research? Because you've been putting some trolley stuff in here in this chat. Anyway, moving on to Delisa. Delisa's got a real question here. How can a clinical research coordinator step out of a patient role without it being a CRA position? Uh, Very good question, Delisa. What if I told you that clinical research coordinator to CRA is probably the easiest position to do, and then go from CRA to project manager? That's, of course, one pathway. I have seen coordinators that do not want to travel, very anti travel, go the in house CRA route. Things are moving more remote anyway. So probably not a bad place to be in an in-house CRA role in the first place. So that's another role I've seen people do when they want to go from coordinator, but don't necessarily want to travel. But I really encourage everyone to go CRA first, um, just because your income's going to go high, and then if you do that for a year, don't like it, then want to go in-house CRA, they're going to keep your income the same. Um, you're just not. CRAs get treated with a lot of respect and decorum in the industry. It's a great position to be in. You're in a lot of position of power. Um, you don't. The job opportunities are endless, so you feel like you have a lot of control and stuff over your career. So I really recommend CRA for most people if you can do it. What is SAS? Not sure. Do you mean software as a service? What do you mean? I don't know what SAS really means. Um, all right. Before we go any further, let's talk about career consultation because I just got an email about someone wanting to do it. Um, so career consultation, guys, you might have heard on many episodes we talk about resume review program, career consultation, interview preparation. So I do offer career consultation, 30 minutes or an hour. If you would like to talk with me one on one about your specific situation, of course I can come on here. You can ask your question or whatever, but you're not really getting the most thoughtful answer because I don't know your situation. And that's where scheduling time with me, career consultation, where we can kind of dive into it, could be more beneficial to you than just me, you know, going off the cuff here without knowing your full situation. Everyone's situation is different. Your location is different. It just depends on where you are in the country, in the world, what kind of tactics and strategies you might need to use to get to where you want to go. So that really helps you there. Interview preparation, that kind of makes sense. Helping you prepare for the interview. 30 minutes or 60 minutes as well, or as long as you want. And then resume review program, guys. So if you're interested in any of these things, email me eliteclinicalgroup@gmail.com. Links are in the description. Links are underneath every video as well. So hope that helps. All right, this person, Praful, says, I am from India and currently doing Masters of Science, MSc in clinical research, looking for international job opportunities. How do you do that? Okay, does your school help with you finding these internship opportunities? You're doing a master's in clinical research, for crying out loud. They should be able to assist with that or at least point you in the right direction. So I would start there. Other thing you can do, Indeed.com, LinkedIn is great. I just saw recently Amazon Jobs. Amazon Jobs is a thing as well. Okay, Delisa asks, what's your background in clinical research? Great question. I started as a project specialist many years ago, worked my way up to an in-house CRA. It was actually a central monitoring associate. Same type of thing, in-house CRA. Then I transitioned to a CRA role, and I've been doing that for going on 6, 7 years now. So been in the industry a while, seen a lot of things come and go. But yeah, I'm a CRA, diehard CRA. Love being a CRA. We were working remotely before working remotely was cool, before everyone else was doing it. So it's when COVID happened, we were used to working from home. Everyone else had to adjust, but we were used to that. So I love being a CRA. It's one of my favorite things. I really don't see myself definitely not being a project manager um, or really much else. So I really like being a CRA. And right now I'm not really traveling that much, to be honest. So I'm actually itching to get back on the road. I love being on the road, love being in different cities. We've got great memories. I was in San Juan, Puerto Rico. I was traveling back and forth a while. I think I mentioned that on the channel a lot. Maybe even showed some videos and stuff. San Juan, Puerto Rico, New Orleans. You get to go to a lot of cities that you don't typically travel to, and it's on someone else's dime. I mean, come on, guys. How can not appreciate that? So New York City a lot, Fort Lauderdale, Miami Beach, up on South Beach, Nashville, Tennessee, Charleston, Washington D.C. Even got some cool cities, Albany, Syracuse. Going up there and snowboarding in the wintertime. So it's really a great role. I can't speak enough about being a CRA. I think everyone should do it, or at least do it for a short period of time. And not to mention, it gets your salary up. So when you decide to do another role, they're going to keep your salary about the same or give you a bump. No, I'm not a contract CRA. I may do that in the future. The problem with that is, well, there's no problem really. You're going to make more money, but you're also going to probably work a lot as well. But I mean, there's pros and cons. I've heard a lot of people will do 6 months on and then they're 6 months not working because you just make so much money. Maybe you'll do two or three contracts at a time. Um, I don't know. I'm still deciding. I like working full time right now as a W-2 employee, getting those benefits and stuff. It's nice. I'm actually kind of in a lull right now. I'm not really traveling that much right now. I haven't traveled for work. Maybe December, maybe November. It's really been a while. Um, and you're not going to get that with contract. So I'm able to like kind of focus on other businesses and other endeavors and come here and pour into you guys on the channel here. So yeah. And so, so far I'm really, really pleased with the amount of people and the questions I'm getting. So I definitely will do these lives more if you guys show up and ask questions. Trying to figure out the time. I think last time we did probably around midday. Today I just scheduled it and did around 2 p.m. I think next week I will schedule one for maybe like 7 o'clock, and we'll see if more people show up. We'll see if more people like the 7 o'clock lives. We'll see. Which softwares are used in clinical research? Man, that is, I mean, I don't even know how to answer that because there's so many softwares used. It just depends for what. Like, are you talking about any specific function? Um, CTMS system metadata CTMS is very common. Um, EDC systems, electronic data capture. We're talking metadata rave. That's a good one. We're talking Medrio I've used before, but metadata rave and metadata CTMS are probably the two biggest. TMFs, we're talking Trial Interactive. We're talking Viva Vault. We're talking FlexiView. FlexiView is pretty good. There's a lot of these softwares for different functions. I would say my favorite, metadata rave and metadata CTMS, they're not the sexiest, but I would say they're the most reliable. And I think that's very, very important, especially as a CRA. You don't want to have to be fighting with the system just to submit your reports and stuff and do your work. And I've noticed that with some other ones, they're a little bit more clunky. But metadata rave never had a problem with. All right, guys, what kind of questions do we have? So I got to send this guy an invoice. So a lot of people ask how I accept payment for services, and we do everything through PayPal. So reputable company. You guys have heard of them, probably even used them before. Um, can you guys hear me? Okay? Can someone type in the chat if you can hear me? Can someone type in the chat if you can hear me? Okay? Is it loud? I don't even know where the audio is coming from, to be honest, because I got my microphone in, but I don't think audio is actually coming from there. Okay, y'all can hear me okay? Then we'll keep going. Yeah, so taking payment for services. Yeah, guys, I don't do video. Yeah, there's no video. I'm just tapped in with you guys. We're just gonna be answering questions here. Uh, yeah, I don't know. I don't know. I think maybe one of these times I'll get an actual software here. I'm just trying it out, Delisa and Avinash. I'm just trying this out to see how many people show up, how many people actually are interested in me going live, or just like the normal type of pre-recorded videos. I'll probably get some kind of thing to put up there just so it's there. But yeah. Um, are there any other questions? We've been live here 19 minutes, man. I'm telling you guys, I really like going lives. I really like going live. Um, Time just flies. I can't believe it's already been 20 minutes. I can't believe it's already been 20 minutes, guys. Any more questions? Delisa, you asked some good questions. Um, oh, okay. Joshua tapped in. All right. Um, Joshua has a good question. Can you talk about taking on multiple CRA contracts as a 1099? Good question, Joshua. I'm not the guy to talk to about that, honestly. I've never been a contract CRA. That's something I may look to do here in the future. I know it's possible because you're setting up these contracts under your own LLC. So it's definitely possible. I've heard CRAs do this all day long. I don't think there's really any, issue or anything like that that's going to come up. I've not really heard of it as an issue. It's just a matter of how much do you want to work? Because as you know, as a contractor, you are billing per hour. So how much do you want to work? Do you want to be on the road 5 days a week? I've heard of some people, like when I first got in this industry, a recruiter sat down with me, we had lunch, whatever, and he was saying, yeah, I know contractors that will take on multiple contracts for 6 months and then they'll just go hang out on their boat for the other 6 months out of the year. So anything is possible in this industry. And it's really, really CRA that you can do that. One of the best things about being a CRA, guys, is the free amount of freedom you have. Like, I hope no one I work with is listening to this live stream right now because I literally have not done one thing for my job today. I haven't even sent an email today, y'all. Um, Wait, Josh, why'd you retract your message, man? That was a good question. Um, but the amount of freedom you get, like guys, I do my grocery shopping in the middle of the day. I take my car to get service in the middle of the day. I've got all these errands I do in the middle of the day, and it's great. I love the flexibility you get as a CRA. You don't get that with other jobs. Definitely not project manager because you're in meetings all day long. These guys can't do anything else from 9 to 5. They're in meetings all day long, and then they got to do their work on top of it. I just don't get it. Managing CRAs too. If you are managing people, my goodness, you are working to the bone. But being a CRA, you get a lot of leeway and freedom, and I love it. That freedom is priceless. Okay. Um, Pros and cons you've experienced as a CRA. All right. So, Delisa, obviously the pay is a big pro. You get paid faster and more as a CRA, as experienced CRA. Um, Pro also is the freedom. Pro is the point accumulation. I haven't paid out of pocket for a vacation since I've been a CRA. And I've been very, very disciplined with that as well. If I can't pay in points, I can't go. But I have not paid, and I vacation a few times a year at least. Um, so, I've not paid for a personal vacation out of pocket. I've been using points all these years. So that's another big pro. Um, Pro, I mean, if you're a big foodie, you get to go on the company's dime and eat at some of the most delicious and expensive restaurants in the country that you probably never spend your own money at. Stay in great hotels, great views. Um, I would say if you're the con would be, I guess, if you have a family, that can be a con. It just depends on how things work like that. If you have a supportive partner or whatever. But I'm single, no kids, so that's not an issue. Another con, um, I don't know. I mean, I would say you could probably get out of shape. You got to really watch yourself. Can you guys still hear me? It's saying my connection is okay. We're back. We're back. Um, so it really just depends on you what you find a pro and a con. I think everyone's going to think the pay is a pro and the lifestyle is typically a pro, and it is great. Um, I don't really see too many cons with it. I mean, like I said, CRAs were working from home before the pandemic, so that's not really a big draw now because a lot of people are working from home. But if things start to go back normal, where people go back in the office, I don't think it's going to go that way. But if that were to happen, CRAs would still be from home, so that would be a turn into a pro again. Anyway, Josh, you've been asking about these multiple contracts, man, then retracting these messages. What's going on? You got to leave those up. So, but to go back to that, your contracts, working multiple contracts. No, I've not seen any issues with that. I've not seen any issues with multiple contracts or heard of any issues. Now, if you've heard some issues, please email me, Elite Clinical Group, if you don't want to write them here, because I'm definitely interested and would love to talk to you about that. But I have not seen any issues with that. Suggest some apps in the store. So I have an iPhone, so I can't suggest the Play Store. But I will say, every app store is going to have one of these apps, one of those scan to PDF apps where you can scan a document and turn it into a PDF. I use that every day I'm on site. So that's probably my biggest app. Another thing that's very helpful is having a hotspot. Your company should pay for it. I probably wouldn't pay for it myself, but it is very, very helpful. A lot of sites don't have great Wi-Fi, and you can't get, yeah, they don't have great Wi-Fi, so you need a hotspot. I've been in sites where I'm on the hotspot all day, or it's very nice when you're someplace you need to send an email or something, having a hotspot. So I say those are two devices, apps, etc., that are very, very helpful for a CRA. Of course, the travel apps. I fly Delta, I do Hilton, so those apps are great as well. Who can participate in a clinical research study? I'm doing a bachelor's of science in microbiology. Can I enter the clinical research field? Yes, you can enter the field. Um, I mean, it really depends on who the target population is going to enter the study. I mean, you'll have to read the protocol to see who qualifies. So it's going to be based on inclusion exclusion criteria in the protocol. That's basically going to be it. All right, guys, send in your questions. Send in your questions, guys. This has been fun. I hope people get value out of this who are able to watch this after the fact, um, and I think they will. So I need to send this email here. PayPal. Okay, let's get some more questions going. I'm sorry, guys. I'm trying to respond back to this email. I have a career consultation today in a couple hours, so we're going to do that as well. So if you guys are having issues getting in the industry, running into issues, leveling up, anything like that, um, we have stuff for you to help you out. So I'm doing a career consultation here with a gentleman. Um, he's a research nurse at PBD, looking to transition into a CRA role. Many of you guys have heard about PPD because they are a pretty large CRO here in the industry. So PPD is a great company to work for. And they have a CRA program, I believe, as well, um, a CRA training program. So if you have no industry experience or very, very little, that's pretty much the only way you can be a CRA without experience is one of those programs. All right, we got more questions here. Do you have a personal experience with Cineos? Yes. I got my first job in this industry. Actually, Delisa was asking about my, I guess, my career path earlier, and I forgot to mention, I actually got my start in this industry with Cineos way, way back in the day. I was a contractor with them first. I forgot about this. I was a 3-month contractor with Cineos Health and had no experience. I was making like 11, $12 an hour. So when I say I started from the bottom, I really started from the bottom, guys. So don't be afraid if you're trying to get in this industry to take a little contract. Take a little contract because a lot of times those roles will transition. They'll either extend the contract or they'll be able to put you in a full-time position based on your experience. That little bit of experience, guys, adds up quick. It can change your life just having a couple months of experience on your resume in this industry. And I noticed that. And yeah, you guys should notice that as well. Let's see, it's going, what's 30 minutes? So it's going to be, how many minutes? Let's do 65. All right, bring in those questions, guys. Sorry, I'm sending this guy this invoice here. So we do all our payments through PayPal for any questions like that. 30-minute career consultation. Oh yeah, and prices have gone up a little bit, guys, for anything. So, like Fat Joe says, yesterday's price is not today's price. So I know the value that we bring to the table here. Um, and it's great value, great value. A lot of you guys are going to be making, especially for you CRAs, you're going to be making 70, 80, 90 grand in your first role. What is $100 on an interview prep? What is $100, $200, $300, whatever it is, for resume review, interview prep, all that career consultation? What is a few $100 invested in yourself when you know you're going to make 80, $90,000 in your first role? Even for you guys that are trying to be CRCs, CTAs, you're going to make 45, 50, maybe 60 grand in your first role. So don't be afraid to invest in yourself, guys. All right, let's continue to ask some questions here. Do I have personal experience with Cineos? Oh yeah, I kind of got off track here. Yes, so I started as a contractor making about 11, 12 bucks an hour with Cineos Health. It was a 3-month contract. I eventually parlayed that into a full-time role. They weren't called Cineos back then though. That was before they merged with Inventive Health. They were a different company back then. But yes, I did work with Cineos. I think he meant as a career, not a subject. I don't know. His question sounds like he meant it as a subject who can participate in a clinical research study. So unless he clarifies, uh, then we'll take it as that. Books available online for CRAs. All right. I have no affiliation other than me and Dan Sfera are friends and colleagues in this space. His book is very good. Uh, it's called, where's the book? Oh, let me see if I can find it. I'll tell you guys what it's called. I strongly recommend this book if you are brand new to clinical research. Now, it's not needed per se, but if you want to have a leg up and kind of understand clinical research a little bit more, I definitely would go get his book. And I did a review on it on my channel too. So if you go back, you can type in Clinical Research Guru or Dan Sfera. I'm sure my review of it will come up. But it's a really good book, and I'm not just saying it because we're friends. Let's see. Okay, I found it. The book is called The Comprehensive Guide to Clinical Research, and it's by Dan Sfera. It's about 200 pages. It's very good, very good. So this is the only book I would recommend, really. Otherwise, just watch the free YouTube videos we post. I post here, and yeah, that'll take you where you need to go. Avinash says, what is the difference between an observational clinical research study and a clinical trial? A clinical trial is what we do, randomized clinical trial. You have 2 sets of subjects. One takes the medicine, the other one's taking placebo. That's basically how it goes. Observational is just an observational study. I guess they're observing what's going on. That's not what we do here. What's the highest amount you've heard of a CRA making? That's a good question. I'm assuming you mean from one job. I've heard of 150,000, but that's not very accurate because that person was there for like 8, 9 years. So obviously, someone goes, they get increased, 3, 4, 5% a year, or whatever. So that's not very accurate because you stay at the company long enough, you'll be making 200,000 or whatever. But that's not very accurate. So the highest I've actually heard someone making, I think. Well, I did see one role for 160,000 apparently, and it was actually a remote CRA role. I don't remember the specifics, but that was kind of an outlier. I think most of my friends I know make in between 130, 140 for one job, and that's pretty high at the time. So things may have changed. 160 might be up there for a senior CRA. That'd be pretty high, I would say. Um, but of course, what a lot of people do is they take on multiple jobs. So you add one job on top of another job, you could easily be making 250, close to 300,000. I've heard of people taking on 3 jobs at a time. Now that's just crazy. But people double dip in this industry, and you could definitely make a lot of money doing that. But it's not a long-term strategy, guys. If you're going to be doing the double dip thing, please do not go out and buy a bunch of cars and crap, because you're just going to work yourself into an early grave. Um, the double dip thing is really for someone who is living very, very frugally and saving up in order to retire. Um, you can only do it for like 2 or 3 years max. You're gonna burn yourself way out if you're working multiple jobs at a time. You got to have a break. So, do you have LinkedIn? Yes, I do. I'm not sharing it though. Um, Everyone should have LinkedIn in this field, especially if you're a CRA. Well, as soon as you get experience, you need to have a LinkedIn. Everyone needs to have it. Avinash says, "Good night, good night, Avinash. Where are you based? If you're still here, I think you said India, but what city are you based in? Where's everybody from? If you're still here, where are you guys from? Put in the chat where you're from. We've got 5 people in here today. North Carolina. Okay, Avinash is from Mumbai. I hope to get out there to Mumbai at some point. I'm a big fan of Indian food, so definitely would love to. Okay, North Carolina. I wonder what city. Are you based in Raleigh or Durham? Chapel Hill. Fun Size says she's based in Texas. All right, what part of Texas? I'm a guess. Houston. You based in Houston? And yeah, Delisa, I think you're based in Raleigh or Durham. If you guys got any more questions, please put them in the chat. This has been fun. I can't believe it's been 40 minutes already. You guys got any more questions? Fun Size says she's from Texas. Did I get your cities right? All right, maybe I did, maybe I didn't. Do we have any more questions going on? Do people have any more questions? If not, we'll call it a day here. Do we have any more questions? I was talking a little bit earlier to the people who came earlier. So if you guys are interested in, these lives are great, but I can't really understand your personal situation that much. People ask questions or whatever. If you want a little bit more help, we have career consultation. Email me eliteclinicalgroup@gmail.com for that. Resume review program, salary negotiation. We just added that this year. And it's great because it's actually free to you. If I do not raise your salary at all, you get your money back, 100% of your money back. So it's really free to you to even add that. Most people are going to get a salary increase of at least a few $1,000s. So it's definitely worth your time to do that. It's worth the extra couple $100s to get a few $1,000s back. So we have that. Interview preparation, guys. We got a lot of good stuff. Do we have any more questions? This has been fun. This has been fun, or is everyone here kind of done? Okay, I don't think we have any more questions. So if you guys have any more questions later, email me eliteclinicalgroup@gmail.com. Take care, guys.